Hello, everyone. I'll just get everybody, give everybody a chance to actually get in and get settled. Lovely to see you all here today. Well, I'd love to see you. I'm sure. Well, I hope you can see me. My name is Margaret Keane, and I am the Education Training and Development Officer here at Midwest ARIES. And for those of you who don't know us, we are a recovery education service based here in the Midwest. So that's Limerick, Clare, and North Tipperary, but we're also available online. And we produce a range of transformative and inclusive educational materials to support people on their personal recovery journey from mental health challenges. So that's who we are. So what are we doing here today? Well, today we're looking at co-production, and that is at the heart of everything we do at Midwest ARIES. This is a topic that comes up a lot, and I suppose we've been holding back on this for a while because we wanted to get the right panel in place, and I think we have that today, and I'll go into that in a little bit more in a sec. Before that, all I want to do is just go through a little bit of housekeeping just to let you know what we're going to do today. So we're going to be here for an hour, and I said thanks for joining us, and I hope you can stay with us. And within that hour, we're going to have, I suppose, an honest discussion around co-production in the mental health services. What does it actually look like? We'll be hearing about some really interesting, hopefully, examples that can maybe will inspire you to use co-production in your own work practices. So, as I said, we're here for an hour. It is a panel discussion. I do have some questions already prepped, but as usual, and for anyone who comes to our webinars, we love to hear from yourself. And you do that by going to the Q&A button now on my screen. It's at the bottom of my screen in a black navigation border. There's a button there called Q&A. If you open that, you can submit a question or even just a reflection, or if you want to give an example, whatever you want to do, that's how you communicate with us. The chat function is disabled today, so use that for everything you want to say to us as panelists and hosts. It is recorded, and I suppose that's the benefit of doing these webinars. And with that in mind, I just want to say a big thank you to Mental Health Ireland. We couldn't do these webinars without their help, and they sort out the recording for us. But this will be available on our YouTube channel and also as a long-form podcast on Spotify or Apple Music or wherever you get your podcasts from. So, so this is what it looks like. So, as I said, get started. Start engaging with us straight away. Who I've got today, and I just get my list out, and I will be kind of looking down occasionally at my notes, so apologies if you're wondering what I'm doing, but we have a great panel for you today. I'm going to start with, and I'll just ask the panelists to, if they can open their or start their video so everybody can see your lovely faces. There we go. And I'm joined by Mike O'Neill. And again, if anybody comes to our webinars, there's two people you recognize here all the time, and that's Mike and Claire. So Mike O'Neill is our manager here at Midwest ARIES. And as I mentioned, Claire as well. Couldn't be doing these webinars without the support of Mental Health Ireland. And Claire is the development officer here in the Midwest. Brilliant to have you here, Claire, as usual. Again, delighted that we're joined by some really busy people, and one of those is Fiona McKernan, who is the National Mental Health Engagement Lead. Thanks, Fiona. Thanks a million for coming today. Dying to hear about co-production from the national perspective, so it's great to have you here. And also another stalwart of, and I suppose our close colleague here in the Midwest, and that is Rosemary Ryan, who's the area lead for mental health engagement. And Rosemary can tell us all about that and in terms of how co-production influences and impacts on her work. Now, we do have another panelist who may be joining us. Unfortunately, has been held up, and fingers crossed, and that is Lorraine Naughton, who's the Assistant Director of Nursing in the Acute Psychiatric Unit in UHL. So even that title alone means this is a busy lady. So just a little bit held up. Hopefully she'll make it. If not, we'll keep going. So with that in mind, let's do a quick round of introductions, and I'll stop talking. And we'll start with Mike. We'll get you to start first, and we'll just do a quick round. So tell us a little bit about the organisation and your role in it.
Yeah, as Margaret said, I'm the manager of Midwest ARIES, and we're the recovery education service here in the Midwest. And I suppose we will get dip a little further into it. But as in a change in the service, we're part of service improvements, part of change. And I suppose informing that change, we do use the model of co-production, and all of our courses that we develop and resources are all co-produced by people who use the service, family members who support the people who use the service, or their friends or carers, and our community partners and our staff across the Midwest as well. So it is that partnership approach in co-production. And as I said, this webinar was part of that response to those needs as well. So thanks, Margaret.
No problem at all, Mike, and thanks for that. Claire, I might go to you next, if that's okay.
Yes, absolutely. So I work with Mental Health Ireland. We're a national mental health charity. And our main aim is to promote and enhance mental health well-being and recovery for all individuals and communities. We do a lot of different things, but co-production has been at the heart of everything we've been doing. So anything that you've seen Mental Health Ireland producing over the last number of years has been through a co-production process. Any of our campaigns, any of our information we've produced. So we love doing it. We think it's incredibly important to do it. And that's why I'm here as well today, because I'm a big fan of it as well. So I want to, explore it a bit more with everybody here today.
Brilliant, Claire, and I can't wait to hear about. I know you've been involved in some major pieces this year in particular, so excited to hear about that. Fiona, you're next on my screen. Do you want to say hi?
Good. Hi, good afternoon, everyone. Fiona McKernan is my name, and I'm just one of the mental health engagement and recovery leads within the Office of Mental Health Engagement and Recovery. And we're part of the HSE, as you know, and part of mental health operations. And I guess being invited here today is really wonderful because, like Claire has said, and Mike, co-production is core to all our work within the office. And I suppose our overarching role or job really is to guide and support, people who use the services, family members, our service providers, and also our community partners in that enhancing recovery approaches within mental health services. So that's me. You'll hear from me later.
Thanks, Fiona. And again, excited to hear all that's been going on. And I know myself and Mike have had, you've been a pleasure to work with over the last year while we've looked at Recovery Principles and Practice workshop as well. So excited to have you. Rosemary, we'll get back to you. We'll come to you next, if that's okay.
Yeah. Hi, everyone. Rosemary Ryan. I'm also working in the Midwest HSE. So that covers across Clare, Limerick and North Tipperary. And in my role, I'm area lead, but I'm basically the conduit for people's views and input. So it's family members, service users, carers and supporters. And originally I got involved myself as a family member, just sharing my views and wanting to be part of positive change. So hopefully I get to speak a bit about that later, but I'm very fortunate in that I get to work with and interact with people at all levels of the service, whether it's staff and service users in the acute unit or in rehabilitation psychiatry or in the community mental health centres and day hospitals. So it's a very interesting role and very fortunate, and it's about the gathering our voices. So
I love that, Rosemary. I love that, gathering our voices. Isn't that what it's all about? And that really feeds into co-production and bringing everybody together, and that equality. It's a powerful thing. I'm absolutely delighted to say that Lorraine has been able to actually join us. And I just want to check if I think Lorraine can hear us. She's waving there. So Lorraine, you haven't missed too much, and thanks. I know you're very, very busy.
No, not at all. I don't know what I did with the link, Margaret, to be honest. As in it just didn't come up. Anyway, I'm here. Sorry, my apologies for being late.
This is what we do. And as everybody who comes to our webinars, is technology is part of it, and it's always the way. But look, I'm delighted that you're here now. We're just doing a round of introductions, Lorraine. So if you could just tell us, I suppose, just, obviously, as I mentioned, you work in the acute psychiatric unit, but just a little bit about your role, and then we'll dig deep into the whole co-production piece. So we're just something about yourself. Yeah.
Sorry, now, Margaret, I'm mindful there's somebody talking in the background. I'm sorry. So very quickly, Lorraine Naughton, ADON in the acute psychiatric unit, working in mental health since 2002. And I'm sure even just looking at the panel without even having heard your introductions would share everyone here's passion around, like what Rosemary just said, I suppose that bringing together of knowledge and experience and everyone's voice to make the service you know, as we would like it to be if we were walking into it ourselves today, tomorrow, whatever day. That's what we need it to look like, and that's what we need it to be.
And Lorraine, you're one of the people that myself, Mike always say this, you know, you live that passion. It comes out in your work practice every day. And we've, again, another person that we've had the pleasure to work with, and we'll talk about a little bit about that, I'm sure, as we go in. So that's the round of introductions done. So let's get into it, I suppose. Let's get into the meat. I thought about how we're going to start this, but I thought the best way to start it is with a co-produced definition of co-production that we have here in the Midwest, and then go from there. So this is what we came in terms of the Midwest, Midwest ARIES and service improvement. This was, I'd say, about 4 or 5 years ago now, Mike. Co-production is a way for people who use the mental health services, including their families and carers and community partners, to work together with people who provide mental health services to make those services better. So again, it's those voices together, Rosemary, that you said, people coming together, but crucially to make the services better for everyone. So that being said, that's a Midwest ARIES or Midwest service improvement definition, a co-produced definition. I want to come to each one of you, and I think I'd like each of you, if you can, to respond to this question. What does co-production look like to you in your role or work practice? And can you give me an example of how it works and who's involved? So who'd like to go first? Who wants to dip the toe in the water? Mike, you've opened your mic.
Yeah. And I suppose I'm going back to 2016 when there was a co-produced working group established. Well, when I joined this co-produced working group, that was established here in the Midwest in 2014, and Fiona would have been involved in this, whereas on the pull-up behind me you will see ARIE. And I was invited on board as a service user representative. And what they were looking at that was, how can we change the service into a recovery focused model, but having everybody involved, the stakeholders, from the outset in designing and reimagining what that could look like. And while there was research carried out, so it did have a family member representative, service user, and then all the clinical leads here in management. So that was the drivers. And out of that came, you know, other stuff like peer support, placement support, a partnership with employability, and recovery education. So there was a pilot project, and out of that then we were established here. So I suppose I would describe co-production as a mindset. It's a way of thinking. And I've only known this way of engagement. I don't know any other way. So and it is, where we use the term co-production, it sounds simple, but it is not easy, and it takes time, a lot of work and effort to get all the stakeholders and all of those steps involved in your co-producing something. And that could be, Lorraine may talk about, we say, like care plans, whereas I might work in education, whereas that's the piece where, you know, we do co-production. All of our workshops are co-produced, but it all comes back to you're responding to a need. So it is not me saying it, it's not a manager saying it or a clinical lead is saying it. You know, we survey across the Midwest, the community, and we ask people what they like. It is one of our taglines. I've often repeated this. What happens when you ask people? And these are the results. So out of that, then that starts the conversation around co-production, and there's various steps in between. Then by the time you get to a service, a product, you know, whatever it is you're working towards. Yeah, thanks, Margaret.
Brilliant, Mike. And I just want to dig a little deeper just with yourself, just to clarify. So for us, who are our stakeholders? So who's around the table for us in terms of co-production?
It is everybody that works in the mental health service and beyond into the HSE. It is family members, service users, and our community partners. So Mental Health Ireland is a perfect example, you know, so there's lots of people have skin in the game. There's lots of Section 39s out there, and we invite all of those to participate in our co-production sessions to get the best outcomes for all. Because if you do this, as I said, it's not easy, but the end result is when everybody's involved from the outset. So we're doing it with people, we're not doing it to, we're doing it for. And when we do it together, the outcomes are better, and the evidence of that is our annual reports and our feedback. You know,
And I
so
think that's again, it's that word again, together. Together.
Yeah.
It keeps coming up. Who wants to come in next in terms of that? So I just wanted to get that perspective from the, I suppose, the recovery education side. Who would like to come in terms of their perspective?
I don't mind coming in there, and it's from, you know, and everything
Thanks,
that Mike had said, you know, co-production, you know, and who it involves, and the people that should be at the table, you know, of what is, you know, of for whatever the end product is, of the person that you're trying to reach, whatever the end product is that you're trying to create, you know, should be at the table from the very, very beginning. You know, it's not a consultation. It's not a case of someone saying, okay, this is what I think people need, and then bringing it to people and saying, what do you think about this? You know, it's from the very beginning, what is needed, what's the best way to do it? And sometimes it's about, okay, who should be at the table? So even the start might be, okay, these are the people we have, but who else maybe should be here? You know, but what I do like about it is that, you know, it is looking at strengths, you know what I mean? It's tapping into what people's strengths, their experience, you know, their personal experience, their lived experience, maybe, you know, and sometimes their professional experience as well. And within our, when we are doing co-production, all the stakeholders that Mike spoke about, you know, we would reach out to other organizations who are in, you know, in a similar, working in the same area as ourselves, but we might also reach out to other organizations depending on what we're doing. Like one of the co-produced pieces we did recently was we created a volunteer strategy. So we invited in other organizations like Volunteer Ireland, you know, to be part of that co-production group. You know, so it can be as broad or maybe even as narrow as you like. It depends on what you're doing, but always from the very, very beginning, the people who you're trying to impact with whatever you're producing should be at the table from the very, very beginning.
And I'm glad you brought up just that, I suppose, this light and dark collaboration, because sometimes people just assume that collaboration is co-production, that's what it looks like, because they can kind of lean into that. It is really at the get-go. So I'm so glad you brought that in and just clarified that piece. And again, we could dig into that a little bit deeper. Again, who'd like to come in next? Fiona, would you like to come in on that in terms of, that would be great. So co-production in terms of your work practice and what you do at a national level, what does it look like and who's involved?
Yeah, I mean, I think, as you know, my main piece of work is recovery education. So I'm the national lead for recovery education, and I guess I'm in that almost 2 years now. And one of the main pieces that we as a group wanted was to have the structures and supports around recovery education and developing it further than it may have been. And I mean, coming together as a community, because that's what, with recovery education, I see, it's not me in the office, it's the community and my network that we work together. And it is that starting point. I mean, we always say, who do we need? And I think one of the advantages we have from the Office of Mental Health Engagement is it is just second nature. I mean, as Mike said, 2014 I started this in, I think, 2012, when I first dipped my toe in ARIES, from being a nurse. And, the whole journey has been like that, the ups and the downs, the going back, going forward. And it's challenging, and I know we'll probably talk about later on of the challenges around it, but it's so rewarding when we get it right, and when we have the evidence and we can stand over. It might have taken a bit longer, but having the office's position within ops, within mental health operations, I think we're really supporting the focus on co-production and getting everyone around the table for other projects and pieces of work beyond us, because it is part of us. So it's actually, being in that position within the HSE and within ops to actually check in and sort of say, well, who have we got everyone we need around the table? And I suppose that a huge piece of that would be the development of the volunteer panel to support co-production. And looking at that and having lived experience, from personal experience, family member experience, who are able to share their knowledge and skills with other service providers, managers, other people who work within HSE who may not have that opportunity. So it really is, checking in and being able to stand and say, well, we don't have everyone around the table. So I suppose we're a little bit of a wormhole, or what you call that thing that we keep playing. That's our theme tune. Have we got everyone that we need? Is everyone here? Who are we doing this for? And have we asked? I like that when Mike said that, have we asked? It's not just what we need, but sharing the vision, as like the mental health policy, and with the 100 recommendations and our office, leading out on 11, but we also support other recommendations throughout. So it is that checking in and signposting and steering people, I suppose, towards that position of engaging with co-production. And that would be really, really important, because as we say, that is core, and it is that piece. We can't do it on our own, and it's not about us, and it's about everyone.
And that's why it's so important, Fiona, to have that kind of national view of things, to make sure that there is best practice around co-production happening, in the different CHOs. But again, I love that sense of community, again, that togetherness. I'm just thinking of those words that are coming out. And for me, it's all about impact. You get impact when you have the right people, if at the right time, sitting, discussing, but right from the get-go. I'm going to come to Rosemary yourself, because obviously Fiona has that kind of bird's eye view, but still very involved. Rosemary, you're out there in the community, you're out there talking to staff, it's part and parcel of what you do in the engagement role. What does co-production look like to you, and how do you use that in your role?
Well, so local around the Midwest, I couldn't do my job unless other people were willing and coming forward to be involved. So it's a big part of my role to probably get that. I'd echo what people have said before, and also that there's a confidence and a kind of a belief needed that what you have to say is valuable, it's valued. So I think that there's work to be done around maybe persons that don't come forward. It might be that the confidence isn't there to come forward, or it's totally new. Even the fact that there is this engagement role within the mental health services is a relatively new idea. And I can go back on my own journey where there was certainly a point where I probably wasn't confident enough about putting myself forward to be part of the discussion. So, and thankfully we do have many people who are passionate about contributing to positive change, and they do come forward. And then there's the work to be done to encourage others to be part of it. Like co-production is the whole wide spectrum. So I suppose that experience of being confident to come forward and being welcomed, it's generally a co-production space is a very welcoming space.
And I think, Rosemary, that's why it's so important to have somebody like you to be that conduit for those voices, to give that welcome and to give that encouragement to come forward. Because, if that voice isn't there, as Fiona was saying, like, it's getting the right people, and constantly asking, do we have those voices? So I think you're really important, that even for ourselves in terms of our co-production piece, getting the word out of our co-production sessions and so on.
Yeah, and anyone who has been involved in a piece of co-production has, whatever they have learned, it probably makes you even more passionate to encourage others to get involved as well. Yeah. Thinking of things in relation to my role, I can't take credit for it. I was a participant when there was co-production around policy change, and that can sound huge, but it was basically starting from where the gaps and issues raised around how policies go out and get responded to, or cancelled or changed. So it involved staff and service users and my predecessor, and that would have been over a course of many engagements, just mapping pathways and the points where there was difficulty. So what need has to be addressed. And some of that looked like just reading of letters, or the communication piece, that was as it should be, that it was engaging rather than cold or administrative, and just putting that together so it's an answering a need and creating a policy which can ensure that going forward, that the way appointments are handled is the way that you would want it to be, and only possible through co-production. No one person would have found the answer there.
And I think that's the way you put it there is so key. No one person could have found that answer. It was having the right people in the room at the right time, or finding different ways to engage to make sure that everybody who needs to be there is in there. Thanks for that, Rosemary. Lorraine, I'm going to come to you, because obviously we kind of work in similar areas. You're at a different type of coalface, as it were. You're in an acute psychiatric unit. Haven't spoken to you before, and we've worked together on various things. Co-production, just it seems baked in, and I'm sure we've got clinicians here today who are really interested in that, because they might be scratching their heads and going like, yeah, co-production, yeah, I know it's in sharing the vision, I know it's that, but like, how do I actually do it? Now, it's just. We can dig a little deeper, but just in terms of your role, what does co-production look like? Where do you see the points where it's relevant?
Again, like, I suppose there's two bits to that, I suppose, Margaret. I'll start with the positive and say, like, the co-production for me is exactly like what everyone else has said, in the sense of that rich, I suppose, information coming directly from somebody who has experienced that. And I don't mean that mental illness, I mean that the service, how the service was met at that point, and what was easy about it, what was not. So I suppose in practical terms here on the unit, we would do a lot of obviously meeting people throughout the day, going down around the floor, again, just letting an organic conversation happen around how you going, how you getting on, what, and getting that feedback directly back. Ourselves, and by ourselves I mean myself and my colleague Siobhan are both here, I suppose, at the management level. And then we have other mechanisms through our recovery and wellbeing group, where that feedback comes back through community meetings, suggestion boxes and things like that, just for, I suppose, as contemporary information as possible. I suppose the less positive side of it, and Fiona definitely alluded to it, and Rosemary as well a little bit, is I think the challenge that we face a lot of the time is, again, that one sentence to go, okay, I'm going doing a piece of work now on such and such. How do I access, the voices to inform the co-production? Because again, you think these things are simple. And Fiona, you said it, like, when you're there working in the office, that's the essence of what you're doing. And so everybody around you is set up with that same information. Whereas I suppose where we're coming from, you start a new working group, or there's a new initiative to be done, and all the professionals, and I'm mindful not to sound disrespectful to that in any mean, I don't mean that in any bit disrespectfully, but will come and sit at the table and talk and put together a piece. And then it may go out for kind of feedback, as opposed to being a genuine co-produced initiative that is going to go out into the service as a wider quality thing within our service. And I think I speak a lot to Margaret and Mike about, having something in your mouth. And I don't think enough of people in the professional capacity have within their mouth to go, if I wanted to do a focus group in the morning, how do I do that? Or how do I, and manage all of the, I suppose we're so risk adverse, like, I'm trying to be as honest as possible, but how do I contact people? How do I this? How do that? And it all sounds probably somewhat almost funny when it's not your bread and butter. But I do think that's one of the challenges too. Like I say, we have Rosemary, and she's amazing, and she will, do so much of that. I can take that back, and I can, find out about that for you. But if you genuinely want to do co-production in the very essence of what that means, and start at the starting point where people are in the room, I think how do we achieve that? Like, how do we get to that point of, getting that information?
And I think it's kind of interesting there, just listening there, Lorraine, because it goes back to even what Mike said in terms of it's a mindset. And I think, like, having seen particularly, the recovery and wellbeing unit there, and you just mentioned there, like, going down and having a conversation on a very human level, on a very basic level. How are you? And involving people in there. Actually, one thing I do want to, we've kind of jumped ahead, which is great, because we'll stay on this track for the moment. No, it's good. We're going to stay on this track in terms of the challenges, because I think that's probably what's in a lot of people's minds here, because, like, and I do want to talk about the benefits as well, because I think there's benefits for all in this process. But you're absolutely right. There are huge challenges depending on where you work. We're lucky because it's built in. We were built with this in mind. We were built for co-production. Acute units probably weren't. So there's a lot of relearning, not necessarily reskilling, but readjusting the mindset. Like, how, I suppose, did anybody else want to come in on that and reflect on that piece in terms of the challenges? And then that Lorraine just mentioned, because I do want to get back to the care planning piece as well, Lorraine, at some point.
Yeah,
Mike.
and I think the challenge is, I suppose, is to build relationships. And I suppose there was something that I suppose Rosemary didn't mention. And again, when we become embedded in the service, we take a lot of things for granted. We assume people know. So to back up the truck, so when we look at, people talk about there's no commitment in the mental health services, there's no commitment in the HSE. Midwest ARIES wouldn't exist if it wasn't for people who are listening and want to implement change to become a more recovery focused service. And it links to exactly what Lorraine is saying. How do we do that? And it takes time, I suppose, to build a service, to come up with ideas around co-production. And I suppose the beauty, I suppose, for Rosemary is she actually sits on the mental health management team. And therefore, she is that representative voice at all times, in all decisions and everything that's going on. And I suppose as part of that, I suppose we are part of that as well, because like Midwest ARIES is made up of people who've used the service, or support a family member who is a friend of somebody, within the service. So it is bringing that experience and acknowledging, for some professionals, to use that word, as Lorraine said, it is difficult to change. And I suppose as a real example of how do you get people on board to change that, it was just, we say, on Monday, I delivered co-production training with CAMS, and in the room was 30 professionals who are willing and want, but I was delivering the skills piece. So now they can go and use co-production in their work practice. So, and again, so to give, it is that education stroke training piece.
And Mike, thanks for coming in on that, because I think you're absolutely right. That is that, it is a training piece. It's giving them that. But sorry, Fiona, I did not see your hand before. I think you came in before Mike. I'll just come to you there.
Very quickly. No, Mike actually had his hand up earlier, so it's fine. I'll forgive you, Margaret. No problem.
Thank you.
No, and I think I can really empathize in one way with Lorraine, because that's where I started off on the wards in nursing, before, and trying to get this whole thing of co-production. And I think the key was that we had a co-production group. And that was, we had that within the hospital, within the service. I mean, again, it was the sort of the purpose thing for ARIE, that we had our ARIE local and regional group. So we were had a representation from all the people that should be there, and looking at, okay, we want to make changes. Changes are coming down. We want to be, how do we do it? And Mike hit on it as well, that relationship thing, that actually sitting with people that you may have nursed, or you may have been a service provider to, to actually sit with that person in a different capacity. Suddenly you are equals around the table. And that is the mind shift that I made, in the sense it wasn't easy. And it's actually that, and Lorraine, you're dead right when you say that whole risk thing and the what ifs and how can we be open and how can we, and it is time, and it's investing in the people that are there and having that clear, agreed purpose. I think that is it. What do we want to do, and what are we going to do? Going way back was looking at our mission statement within the Department of Psychiatry that I worked in. Looking at the statement, going, is this really what our mission statement is about? Is this what we want to do? And is this are we doing this? Are we that tin of Ronseal? And we pulled it apart and we looked at it, and we had a co-production group within the Department of Psychiatry for anything related to that specific area of work. And it wasn't, as I said before, you're up and down and you're coming back and forward, and it's like when you are, as I call it, the blended family. We're changing, the dynamics are changing, and we're seeing people in a different way than we may have seen them before when we were in a position of providing a service. So, it's having the understanding of what is this about. Collaboration, absolutely. But it is, as Margaret, you said it there, it's beyond that collaborative piece. And we do collaborate pretty good, but it's taken it the next steps further to really having that whole continuum of the practice. So it's from the beginning to the middle, in the middle, and into the end. So it is a mindset change, and it's with everything else that we're doing. It's, you know, we can't just say, oh, well, that's co-produced and that's that one element. We co-produce all our policies, or we co-produce all. It is that sense of that it's the way we do business here, and it becomes the norm, and it just takes time for it to become the norm. And that's what we're, you know, we're doing. And, you know, and it can fall off. It can fall off the track, and it can become somebody else's baby more than the joint focus that we would have initially had. But that's why it's so important. You have your agreements, you have your terms of reference that have been developed, and you use the tools that you've created as a group to put, you know, and be able to actually ask people to be accountable for their role, what they said they will do. And that whole I suppose honoring that mutual respect of people. And it is relearning. For me it was relearning, and that's
And thanks, Fiona, for that. Absolutely. No. And it's great having that perspective, because again, from your nursing background, to be able to connect the dots. And this is why we have these conversations, because, you know, just that having that experience, I'm sure is really beneficial for anyone listening who wants to try and do. But I love that thing of just that statement of, this is the way we do business. Like, just that's it, that this is how we do stuff. Claire, I'm going to come to you next. There are a couple of questions there that I do want to come to, but I'll come to you next, and I'll just go to one quick question, if that's okay. And thanks to everybody who put questions in. I will do my best. Can't guarantee, because we've got a lot to get through.
Well, I suppose just going from my own experience in terms of feeling confident to sit at a table with a bunch of professionals that may or may not have offered services to me or to a family member, or, you know, or anything like that, you know, to have that confidence, it takes quite a lot for some people to be able to do that. So the training for professionals, but also the training and understanding for people, you know, the people that you want to be able to sit at the table, who feel confident to sit there, you know, is really, really important as well. You know, there's so much wealth of experience and understanding out there of how things are currently being done. And if we want to make changes there, then the people who are affected by that, you know, absolutely need to be at the table. And that's what co-production, that's what we're all talking about, is to have, you know, these people as well as everyone else at the table. But I think there needs to be that bit of, you know, bit of training, that bit of support, that bit of understanding, but also, you know, for all sides of what are we here to do? What are we trying to change? And like Fiona has said, you know, the work starts in the very beginning, in terms of once you have people, sometimes even before you get people at the table, this is what we're trying to do. This is what we're hoping to impact. These are the supports that you'll be given to help you to do this. And then once you're at the table, okay, you know, doing that terms of reference, making a safe space so people can say, well, this is what I need to be able to feel that I can sit here and speak very truthfully about my experience, you know, that I'm going to be supported in that. So, you know, there's quite a lot of steps. But what I will say is, what I have found anyway, my own experience is, at the end of the day, the product, you know, whatever has been produced at the end of it has been, you know, almost perfect, not always, you know, but, you know, with a couple of tweaks here and there. But having somebody putting in that extra effort at the very beginning for anything that's required is really, really worth it in the long run. And also then, you know, for the people that are engaging with it, they're seeing the services and everything else in a different light. They're seeing the changes being made. They maybe feel a bit more optimistic then, and hopeful, you know, that real change is coming down the path for people who are accessing services now and into the future as well. So I just wanted to make that point about, you know, everyone at the table maybe needs a bit of training, needs a bit of support, and needs a bit of, you know, that little bit of education about exactly what it is and what they're expected to do, but also how they'll be supported through it. Because regardless of what they're bringing to the table, it can be daunting, it can be a new way of doing something, so that can be a bit unsettling for people. So a bit of support around that as well, I think, is always required.
And I think you're dead right there, Claire. And I think from our perspective as well, I think we all need to think about language. Are we all saying the same things? Do we understand what we're saying? There's a question I'm going to come to now, and there's a lot of stuff there, so I'm trying to pull out the key bits. But, you know, we need to make sure that the language we're using isn't creating a power dynamic. It's very easy to happen. You know, HSE, we all know we're full of acronyms for this, that, and the other. But, you know, are we saying what we want to say, and are people actually hearing it like that? I'm just going to come to this piece here, and thank you so much. Co-production is defined by the New Economic Foundation 2009 as delivering public services as an equal and reciprocal relationship between professionals, people using the services, their families, and their neighbours. And this speaks to what you were saying, Claire, I think. How do we make sure that the relationships are genuinely equal and reciprocal. Professionals are being paid to create sometimes a time-bound output, for example, while unpaid volunteers with expertise are not paid, nor do they perhaps have the challenge of time and output, etc. So I suppose that's an honest question. You know, how do we keep it? We might have things in mind. Do you want to come in there, Mike?
Yeah, I'll come in on that. Like, kind of. So, and again, it comes back to, I suppose, yes, what it says, the equal and reciprocal relationship, and that is one of the 6 principles of co-production. And I suppose the training piece that we offer here, we look at that, and that's part of the discussion where we look at that equality and reciprocal relationship. And I know it mentions the issue with remuneration, but while that became an issue, as to resolve that issue or attempt to resolve that, we have 6 people employed here now who are coming from as facilitators, who come with that perspective of either being a service user or a family member. So they are being remunerated in Midwest ARIES to do the job, to participate and represent, be those representative voices in an equal and reciprocal relationship when we do co-production. And we open the co-production then by invitation, that if somebody else wants to become involved in the process. So I hope that answers that question.
And thanks, Mike. And I would also, any of the panelists, if there are questions there, because there's quite a few of them there waiting and they want to actually respond individually, go ahead, you can type your answer in. And again, apologies for those who are waiting, but there is a lot to get through. 2 questions, same thing, but definitely if we can respond to this is, does ARIES, and another one is MHI, Mental Health Ireland, have training for people who want to get involved in co-production? So 2 actually separate questions, one aimed at Mental Health Ireland and the other at ARIES. So Claire, do you want to come in terms of Mental Health Ireland, respond to that in terms of the training piece?
We don't have training, but we, you know, co-production is embedded. So if we are asking anybody to participate in co-production, we would actually, you know, mentor them a little bit if they require that. You know, there would be a case of reaching out to them, having a conversation with them, but explaining what goes on and everything else. And because we want to get people around the table, you know, who are coming in, and giving training is great, but we want people to bring their real experience as well. We want people to be honest. You know what I mean? We don't want to be like almost preparing people in one way to sit at the table. We want people to come in as raw as they are. So because I would be afraid of too much training as well in that way for us. But however, listen, we don't do training. We do mentorship. We do coaching as well. We do health and well-being coaching as well. So, you know, through that we can support people, particularly if a person is feeling vulnerable, but they feel they have something that they want to contribute. We can give that one-on-one sort of support to the person to encourage them to look at their strengths, to be able to feel that they, you know, that they do have the strength and the capacity to be able to sit at a table and participate in co-production. It's something that I can definitely bring back as well in terms of training. But like that, Midwest ARIES are already doing it, and quite a lot of the recovery colleges throughout the country are already doing that. So, you know, so anybody who's close to a recovery college could access training like that through there. And, you know, and there's a list of those on Mental Health Ireland's website as well. And Midwest ARIES obviously is one of those.
Thanks, Claire. So basically, anyone who wants that kind of training can contact Mental Health Ireland. I'll have some signposting slides at the end. We do offer co-production training here. Mike, I'm going to leave that until the end for a signposting piece because I know I have Rosemary there waiting to come in. So I'm just going to come to you, Rosemary, on that, and I'm mindful of time as well.
Thanks, Margaret. Just, I suppose the basis to ensure we start off on a good footing is to have a clear understanding of what are we here for, and the terms of reference. In my own, going back a number of years now, my own role, I was very happy that it was clear to me what we were about at the forum, and I contributed, and was always an important part that you're mindful of yourself and what you contribute. So that's just an important understanding to have. And then self-care becomes a really important part when you want to use and contribute with your lived experience. And I know the self-care workshops from ARIES are brilliant for that. And that mentoring and support is very important. And I'm very thankful to Claire that we've been able to start the conversation on what mentoring or support people might need if getting involved in a kind of a deeper level with co-production. And it is quite individual. And the fact that one-to-one coaching and mentoring is available, and a focus on self-care and that's minding ourselves and minding each other is very important.
And thanks, Rosemary. I think that's key. And I think we've talked a lot about there, obviously, in terms of people using the service or people in mental health challenges and trying to get them at the table and giving them all the support they need.
Can I just mention there, Margaret,
yes, do, Claire. Yeah.
Because I am working on that with Rosemary. So by the end of that, we would hope that we would have a sort of training, if you like, but around if a person is is involved with the forum and is interested in co-production in any form, with any organization, that we'll have a template there that people can use. It's not ready yet. I'm only working on it, so which is why I didn't mention it. But absolutely, in terms of building capacity and giving people support to participate is really, really important.
And I think on the other side of it, and that's something again that Mike might talk about a little bit later, and then time is flying, is that staff need support too in terms of understanding the whole co-production process, what their role is in it, the fact that we were talking about that reciprocity piece, or if they want to run their own co-production pieces. So it's important that we meet everybody's needs, I think, in terms of the co-production dialogue. Lorraine, is there anything you want to come in before we just move on that? I know the challenges piece is huge, and I think it can put people off a lot in terms of, oh, that looks like that's too complicated. How can everybody agree? All of those kind of questions. But believe me, when it's baked in and it's what you do and how you do it, it's really powerful, really, really powerful. And I just want to check, Lorraine, is there anything you want to come in on there before we move on?
No, that's fine, Margaret. Thank you.
While I have you there, I just kind of want to mention it, if that's okay. I did mention it earlier, and it's that care planning piece, because it does come up, and the co-produced nature of that. Do you want to, can you share something with us in terms of what that might actually look like, if that's okay?
Yeah, so with, say, once somebody is admitted to the unit, we have what you could call an individual care plan. And the whole basis and I suppose the idea behind that is that exactly that it is generated from the person's own account of, I suppose, how they have come to be with us in that day. So what has gone on, what's their understanding of that, and I suppose as much that then as the other side of it, and what do you want from us when you're here? What can we do for you to kind of get you back to the version of yourself? And I suppose that's one of the things I would say quite often. When we talk about recovery, and yourselves, again, a lot of the time, you alluded it earlier on, Margaret, around language, words can get used and used and used, and they kind of start to lose meaning in the sense of what that means. And so I suppose if I'm doing a one-to-one myself, I would talk about the version of yourself that to be yourself. So that feeling when you feel like yourself in your own skin, as opposed to still something off, I'm not 100%. But the individual care plan is exactly that. So when you're doing that initial, I suppose, conversation with somebody when they've come into the unit, it's identifying the strengths that they have to help them back into, as I say, their own recovery. And sometimes even the person might not realize or have that connection to, actually, do you know what, now that I said it out loud, it was a culmination of those things. And that information, as I say, I suppose is the framework of the care plan and how the staff and the multidisciplinary team approach their delivery of care then. And that's when we talk about the individualized care, person-centered, that's it at its core, that this information is only in this person's file because it's only come from them. It's not generic one size fits all. It's not that medical lingo. It is that when I hand it to the person and they read it, they go, that's what I said there exactly. And even though I'm not fully on board with this piece yet, because that's the collaborative piece as well, I might go, well, listen now, Margaret, come on, there is a little bit now around, you did say you didn't do this or that, or whatever the case may be.
And I think, Lorraine, it's really, thanks for just giving that little broad brushstroke, I suppose, of what that looks like, because I think the way we've been discussing co-production, it's been having those big groups, getting groups together. And this is where co-production really reduces down to that moment of, the individual. It's their care plan, obviously with the support of the multidisciplinary team. And it's something I think that we need to be aware of. Fiona, I know you want to come in there, so I'm just going to come to you there now. Thanks, Lorraine.
Just lower my hand, sorry. Yeah, just in
I suppose, to re-emphasize the importance of, but Lorraine's talking about that, the individual care plan. I mean, it in itself has its own recommendation within sharing the vision, you know, that all care plans would be co-produced recovery focused care plans. So using the word co-production recovery within the care planning, so an approach and how people practice the development of a care plan, it in itself will be, you know, needs to be re-examined and explored, and how to meet that. And I mean, I'm happy to say we're working on a national policy for co-production itself within that recommendation to have, I mean, some of the areas, actually some of the CHOs have developed their co-production policy and have have developed that locally or regionally. And, you know, taken from that, it would be a benefit that we would have a national piece that other areas can adopt on a co-production, as co-production being the overarching practice for everything. And within that, the development of, there are good resources out there for to support people in practicing in a recovery focused way when it comes to care planning, but it's just to make it accessible, you know, and that people are time limited, and that's one of the challenges that we mentioned, you know. But again, we often have all of this, and you know, these thoughts, we're time limited with so much paperwork, etc., and it becomes the reality, and then we don't think outside the box. And that's where we have key people like Lorraine and Rosemary on the ground in the services to, you know, to keep sort of niggling and say, well, we could do it, could do this in a different way. So it is that whole thing, but it will be backed up, I hope, and we're working on that national policy for co-production, which is hopefully a positive piece.
That's hugely positive, Fiona, and thanks for sharing that with us. I think that's really important for people to know, everyone to know, that that's on its way. Mindful of the time now, mindful that there are questions there, and apologies for people who have put questions in. What I'll do is, if they can't be answered today, I'll take note of them, put them to the panelists after the fact, and if we can get an answer to you, we will. As you know, at the end of every webinar, we do send out a learner pack with signposting slides and those and also links to the webinar recording. So we'll try and get back to you on that. Again, with the time involved, and this will be one of the questions that's come up, and it's around the benefits. And I'd like to end on that now. I want to keep the last 5 minutes for that signposting piece, so we're very tight on time. So I want to come to each of you. And if you can just give me a brief, like, sell it to me. Why does co-production work? And why should we be doing it? So keep it brief, and I'm just going to go around. Mike, briefly, why does it work? Why should we be doing it?
Why does it work? I suppose the evidence and the evaluation says it works. And because it comes back to, we ask people, and we stay in this loop of what we call a co-production cycle. So we're constantly reviewing and responding to the evaluation every time we deliver our service. And I suppose when we look at the CHIME model of recovery, which is personal recovery, and when we look at hope, we've had in both our adult acute units here 160 plus workshops in our most recent annual report in a 12-month period with over 1,400 attendees. And these are people who are at a low point in their life. If they're in hospital, we can make that assumption. But 89% of those people who attend our workshops are hopeful of recovery. So when you look at that as a measure or a metric, it works. But I think by also we can model best practice by, if we are successful and we use co-production, that eventually speaks for itself, and people come looking for the skills, the training, the understanding, and the knowledge. Thanks, Margaret.
Thanks, Mike. And again, keeping it brief, Claire, I'll come to you. Co-production, why is it so great? Why should we be doing it?
My most recent experience was talked about because we recently co-produced a booklet on menopause and mental health. And while I had my own experience of that, it was pointless in that just putting my experience in there. So through the co-production process, we had so many voices, so many experiences of people who themselves had been directly affected or would work in the area and would work with people who were directly affected. So we had so many different perspectives. And from having so many different perspectives, we believe now that we have something that will appeal to a lot of people and will give some answers. It's not the de facto answer to everything menopause and mental health, but it is our resource that gives information, that gives support. And a lot of what is in there was put forward that people need to hear this, women need to know this, this is what I was missing, this is what I needed at the time. So many voices similar to that. So that's why co-production works. And the feedback we're getting since we launched it is that this is just what I wanted. I really needed this information. We really want this information to give out to everybody else. And it's because of co-production. I could have written something about my experience at menopause and mental health, and people maybe would have read it, but it was only ever going to be based on my experiences. So having so many different people's experiences inform that document has made it, I think, a lot more informative and a lot more beneficial to the people that we're aiming it at, because they were involved in it from the very beginning.
Thanks, Claire. And brilliant. Fiona, yourself, in terms of your experience, co-production.
Sell it to you. It builds trust. You know, it's we all own it. The HSE is not just a structure and organisation that belongs to the HSE. It's actually fundamentally there to serve the people that need it across all departments. So by practicing in this way, by inviting and asking, and saying we can't do it on our own and we don't have all the answers. And it's almost like something I would have, you know, on a one-to-one with somebody when I was nursing was, you know, ask the question, what do I do? And I said, I don't have the answer, but together, let's try to figure something out that will work for now. And that was a very a very small example, but it is for everyone. And the benefit is that people who use the service will see, yeah, well, actually, I'm being listened to. What's important to me is being taken on. People who work in the services actually, you know, I don't have all of this weight on my shoulders to do it all, and let's share and let's have that shared responsibility. Let's make things better together for everyone involved. So
Brilliant, Fiona. We all own it. Love it. Lorraine, I'll come to you next in terms of
Hello?
Can you hear me there, Lorraine?
Sorry, I lost you there, Margaret.
No problem. Just if we
no,
can keep it brief, co-production,
yeah,
why should we do
very quickly,
it?
I think, I think basically it is that bringing of the evidence base and all of that lovely work that's going on in the world to humanizing that to people. Everything we're supposed to be doing is about people, and not this separateness that is almost ingrained and unconscious bias within our mind about let's meet those people and find out what they need, as opposed to it's any one of us. It could be any one of us at any day. And those, you know, I think that process of bringing that stuff together, I think that's for me.
It is, Lorraine. It's a very human response, I think. And Rosemary, just finally, again, very briefly.
I'll keep it brief. It's just why it works, because it challenges the inner dictator, if you happen to have it, in that no one person has the ideal answer, the perfect answer. And in fairness, it isn't even about the perfect answer. It's about the common understanding. And I think the big part is that it requires confidence to be involved, and it builds your confidence when you hear from others and their perspective may be similar or entirely different, but co-production can surprise you that way. So it's always interesting, and the outcome that you're going after is always better because the voices came together.
The voices came together, the impact is better. Mike, I might get you just put the feedback form, if you can, in the chat. There's also a question there that I think you should answer, if you don't mind, when you get a moment. And thanks to Fiona and Claire for answering some questions that they come in. Much appreciated. While you do that, I'm just going to literally rifle through, but you will get these, the signposting piece. So yeah, these are two, I suppose, examples of our co-production here in the last year. One is with Lorraine, and that is Understanding Acute Mental Health Services for Families, Carers and Supporters. It is a resource that's currently being used in the acute services, where you actually walk through and you see, not just to see what it looks like in the acute service, but what kind of services are there, and crucially you meet the staff in a very human way. We are also developing, and this will be launched in November. Well, it's done and dusted, and it's a bit like I'm in, you know, Claire, in terms of yourself, that, you know, I suppose the reproductive health and how it impacts on mental health. So it's my perinatal self-care workbook. It's a very detailed 44-page workbook. Was asked for it, co-production, for women who are either antenatal or their child is up to a year old, but lots of good stuff in there. Co-production training has come up, obviously, in the course of the discussions. We offer co-production training led by Mike for our HSC and community partners, and it literally goes through how to do it and how to do it well. And it's a bit like, you know, feeding the village by teaching somebody to fish, you know, themselves, so that you give them the tools basically to go on and use co-production in their work practice. Again, you'll get these slides, but contact Mike if that's something that you are interested in as a community partner or as a HSE partner. Again, we're online in terms of our workshops, so you can book on Eventbrite. You'll get the link in your learner pack, and we're also face-to-face in November. November now we're talking about. So in both Kilmallock, Nina, and we're doing a research piece as well on creativity for wellbeing in the Hump Museum over the next 6 months. We started last month, and it was absolutely fantastic. Again, a co-produced course. Join us next month for mental health education and employment. Is there a connection? It's a webinar looking at how mental health can impact on our, I suppose, our educational outcomes and also our life chances in terms of careers. You've already mentioned this, Claire, and I'm sorry we can't give it more time. You can put it in the link into the chat. It would be really helpful. And I know we're very close on time, probably went slightly over, but this is amazing. It's a fantastic pocket guide on how to manage the symptoms of menopause and mental health. And thank you to Claire Flynn for leading on a much needed resource. And there's Claire's details there. Again, you'll get this. And Rosemary does an amazing job. We couldn't do what we do without engagement. It's a core part of what we do. She mentioned Chimers earlier, and local mental health fora, which is not just Limerick, but also North Tip and in Clare. If you want to get involved in that, get in touch with Rosemary and find us online. We're everywhere. So we're on as the Wellness Panel, which is our basically our podcast, our long form podcasts of these webinars, and also on YouTube as well and across all social media. So I'm going to stop the share now and just basically, guys, if you want to just say your goodbyes and thank you for staying. We're 1 minute over and thank you for staying. And I just want to say a huge thank you. As always with this, it goes by like it's gone. We need to revisit this, guys. We really do, and really dig a bit deeper. But thank you for your time. You know, I know you're already busy. Claire, do you want to say hi? Or goodbye, rather.
Hi, goodbye, and thanks
goodbye.
for facilitating that discussion. Thank you. You did a great job.
Thanks, Claire. Oh, thanks, Claire. Much appreciated. Fiona.
Bye. Thanks a million, Margaret. Thanks, everyone.
Mike.
Yeah, great stuff. We need to go with this again. It's too big a subject to get done in an hour, and we need to crack on with this one. Definitely. Yeah. Bye, everyone.
Brilliant. Lorraine.
Thanks a million, everyone. And yeah, absolutely. I'm up for it whenever we can do it again.
Fantastic. Good to hear it. And Rosemary.
Margaret, thank you so much for facilitating with ARIES, and really enjoyed hearing from other panelists and the questions as well. So delighted to be part of it.
Brilliant. And we just got to thank you there. And thanks. Apart from all that, thank you for sticking with it and for engaging with it. I know we didn't get to everybody's questions. I'm sorry about that. This is a huge, huge subject, but I hope you found some inspiration, and definitely in your learner pack, you'll find ways to engage with us and maybe bring that conversation forward a little bit more. Feedback form, Mike, it's in there. There is the feedback form. If you look, guys, it's actually under a weird link called Scanner TopSec. It's just the way the HSE actually, I suppose, interprets URLs. That's where it is, and we'd love to get your feedback. And I hope you got something from it. Okay, so I think we're all done. And on that basis, thanks very much, and we'll close it down. Take care, and whatever you do today, be kind to yourselves and each other. Take care.